welcome to Tigerlily First Aid Training. In this video we're going to guide you through the correct first aid treatment for babies and children that have suffered a fracture. In particular, we're going to look at the most common types of fracture, the signs and symptoms to look out for, and the correct first aid treatment. So let's firstly look at what a fracture actually is. Well, a fracture is essentially a crack or a break in a bone, but the extent and nature of the fracture can vary greatly depending on what caused the injury, exactly how the bone was damaged, and the child themselves. In some cases it's obvious that the fracture has occurred, but in others the signs and symptoms can be more subtle, especially with children. So what should we be looking out for when we suspect or know for definite that a fracture has occurred? Well, there may be a pain or a tenderness in the location of the injury. You may notice a deformity or a shortening of the limb. The limb may move unnaturally or lack mobility. Swelling or bruising may have developed. The child may be experiencing what's known as crepitus, which is a sensation of bone grinding against bone, or perhaps distressingly, bone protruding from the child's skin. So how should we treat a child that we know or suspect has had a fracture? The first aim is always to ensure that the injury is kept still and supported. You can do this easily with pillows, cushions and blankets, or anything soft and flexible. It's important not to straighten the fracture, and it's also important not to give the child anything to eat or drink, as this can cause delays to medical procedures later. But make sure that you do comfort and reassure the child and keep them warm. Having assessed the injury, you'll need to decide whether to call 999 or 112, or whether the child needs to be taken to A&E. As a guide, we recommend calling 999 if you are unable to get them to A&E without worsening the injury, the child is experiencing excessive pain, a spinal or a head injury is involved, and the child has difficulty breathing or their blood circulation is hindered in any way. You need help immobilising the injury, or if you are in any doubt about the seriousness of the injury. Whatever action you do take, please don't protect the injury with makeshift splints. A few other key points that you may find useful. Children's bones continue to develop and grow from birth through to adulthood. This makes them generally more flexible than adult bones and more prone to what is called green stick fractures, where the bone bends and doesn't break completely but cracks. Green stick fractures appear like a sprain or a strain, and the only way to establish the extent of the injury is by having an X-ray. So, to summarise, fractures can often be hard to identify in children unless their signs and symptoms are obvious. If you suspect that a fracture has occurred, keep the injury still and supported. Don't straighten the fracture or provide the child with any food or drink. Instead, provide them with comfort, reassurance, and keep them warm. Always seek further medical attention if you feel the fracture is causing the child excessive pain or is preventing correct breathing or circulation. That concludes our training video on the first aid treatment for fractures. I hope you found this information useful. Thanks for watching.